The New York State Office of Addiction Services and Support, or OASAS, provides this podcast as a public service. Thoughts and opinions expressed do not necessarily represent or reflect those of the agency or state. This is Addiction, the Next Step.
Hello once again, and welcome to Addiction, the Next Step. I'm your host, Jerry Gretzinger, and we're coming to you from the New York State Offices of Addiction Services and Supports, our lovely little podcast studio, which is actually just tucked into the corner of an unused office. But you know what? We're doing a lot of good work here, having a lot of really great and interesting conversations, and we are going to have another one of those today. You are probably well aware that the state of New York, certainly our agency and a lot of other partners and providers have been working really, really hard to address the overdose crisis. We've had far too many people lost to overdose. We know the presence of fentanyl that's come in to the country, and that's been finding its way into illicit pills. And unfortunately, a lot of people have died as a result. But finally, we have some good news to pass along. We've been hearing all this kind of talk about the sudden and finally this reduction in the number of overdose deaths that we've been reporting, certainly throughout New York State. And there are some areas in New York who have even greater headlines to tell about this. And we are joined today by a gentleman who's going to tell us about the wonderful headline that they've got to talk about, and that's Steve Kilburn. He's the Substance Use and Addiction Services Coordinator for the Chautauqua County Health Department. Steve, thanks so much for chatting with us today.
Well, Jerry, thank you for inviting me to be on. And as you've introduced, it's nice to be able to come with, I guess, what I'll call better news. Good news, hard to come by in the topics of overdoses, obviously, but definitely better news than we've been looking at for literally years. Yeah,
and so as you well know, and I think most of the people who are listening to this know, we've seen far too many years where the number of deaths attributed to overdoses has inched up, has gone higher and higher to really historic levels, and really it's been all anybody could do to try to get on top of that and to do anything they can to start bringing the numbers back down. And finally, as I mentioned, we're starting to see some of that. And before we even have this conversation, we want people to know we are not saying, "Hey, great victory, we're done."
Accomplished.
Right? No, not at all. But it is nice to see that some of the efforts are starting to have an impact. And let's talk about Chautauqua County here. We know we've got some really good information, some really good news to share about the effects of all this work that's being done.
Yeah, Jerry, you mentioned historic levels. We've seen that nationally, New York State. Sadly, we've also seen that here in our own Western New York County, Chautauqua County. 2023, in fact, was our highest recorded number of overdose fatalities. So, we've been tracking along with some of the trends that we see on the national level. But the story this year is so dramatically different, and happily so. Namely, here as we're recording this in the middle of October, so 9.5 months into 2024, compared to the very same time period in 2023, we are literally less than half of the number of overdose fatalities, which, really by any measure as a public health metric is stunning. And so, again, we acknowledge the number is not zero. There are still families grieving. But we also believe that there are many people who haven't passed away that might otherwise have if we, of course, weren't seeing this dramatic reduction.
Yeah, and you make that point, and it's a good one that until that number is zero, there's work to be done.
Absolutely.
And really, I think what we take away from this now, we see some of the efforts and the impact of these efforts bringing these numbers down. And I think it kind of emboldens us to say, okay, something we're doing is working. We got to keep going at it, right? So let me ask you that. So when we talk about some things must be working, what do you feel? What are you seeing in your area? Some of those things that are making an impact.
Well, that's the big question. Yeah. What can account for such a dramatic improvement in the situation? And I certainly have some I think, somewhat obvious suggestions of what that is. But I also worked in the field long enough to sort of take as a premise that addiction always defies every sort of simple explanation. Either it's trending up or trending down, or, there's so much about it that is such a complex issue. Having said that, though, clearly the distribution of naloxone, Narcan, into the community, and like a lot of places, we have made that such a priority. And of course, it saves lives. In addition to just the sort of, if you will, common sense conclusion that distributing Narcan widely and broadly, and by the way, we do so with so many avenues, so many partners. But beyond just the sort of assumption that that's making a difference, we have certainly a lot of anecdotal evidence to suggest that, this has been one of the reasons why many lives have been saved. One of the kind of hard metrics that we can point to is, and this is data that really was tracked over 2023, but by the last quarter of 2023, our largest EMS service that covers the two cities in our county, Jamestown and Dunkirk, they were reporting that in literally half of the occasions where they would respond to an opioid overdose, the patient had already been administered Narcan. So that may have only grown in the months since. That's, again, data that's a little dated, but it at least, and that was trending in the right direction, up. So we do see, strong evidence that Narcan distribution has made a profound difference. So clearly we would, attribute our improvements to that in large measure.
Yeah. But
I would say there are other things as well.
Yeah, I was just going to continue on the naloxone point for a moment. I think, because, even at the state level, we've been doing as much as we can to make sure that naloxone and even test strips are available and sent to whoever wants them for free. I mean, so it's really been a focus of ours, and I know of so many other organizations as well. And I think what you just said kind of gives us the other side of the picture, right? We know the significant amount of supplies that we've shipped out, but to know that they're being utilized,
that's right.
That's the kind of story that we've been looking to hear, that it's not just arriving in someone's hands, but that they're putting it to use.
Yeah. No, I'm glad you have said that, because, as a public health intervention, the availability that the state of New York has made to communities across the state for Narcan freely, to us, available from the state. And then, of course, we're able to freely and broadly distribute it. It has been a massively, I would say, successful public health campaign. And, kudos to the state of New York. I hear from colleagues now and then from other states where, access to Narcan isn't nearly, I don't think, as available as New York State has made it. So this has been, I think, really, it's taken, it takes time to build, I guess, systems of distribution. It takes time to build awareness, kind of normalize the fact that this is first aid and, should be on hand. But I think, again, as one of the contributors to, in our case, a dramatic decrease, I think we've got to acknowledge that the state of New York has been wise in investing in the wide distribution of Narcan.
Yeah. And like I say too, I think it's great that the supplies are utilized the way they are intended to be utilized. And we're actually, I will say this, a plug for us, we're trying to get people to share their stories with us about utilizing these products, so that people who may not have received them yet and may not know about how to use them can see other people's stories and say, okay, I can do this. I want to do this. I want to be a part of this, part of the solution.
That's right. And not that I'm personally aware of them, but we would literally have hundreds of those stories just in our county. I feel sure that that's the case. And, the distribution of Narcan too is, there's no, it's one of the easiest medications to make widely available. First of all, there's no diversion, there's no other reason to use it. And, no medication, I guess, is harmless, but in terms of its capacity to cause really any kind of harm, if it's used in an instance where an overdose hasn't happened, it, is essentially nil. So it's lent itself very well to getting out into the hands of the public.
Yeah. And so, just to kind of go back to where we started from, saying that, while we report, thankfully a downward trend in the numbers, we also attributed what was the uptick to, the presence of fentanyl, certainly. Yeah. And while we're seeing a downward trend in the number of deaths related to overdose, I don't have any information saying that we're seeing a downward trend in the presence of fentanyl.
Well, I was looking at that in preparation for our conversation today. Clearly, it's fentanyl principally that's accounting for the deaths, and that remains the case. So we don't have, when I report the numbers, a nearly 52% decrease at this point. Not all of those are actually confirmed at this point. So I don't have the toxicology reports from all of the fatalities in 2024. So what I'm about to say is limited in that it's based on maybe half of the year or so that we've gotten that data back. And what we're seeing, whether this is the case across the state and other places, I don't know. But what we had been seeing for at least a couple of years, similarly, of course, fentanyl rising, but stimulant use has actually this year reached a level where it's really at about the same level, appearing as frequently in the cases of fatal overdoses as fentanyl does. Wow. Now, often, of course, both are appearing, right? So methamphetamine and fentanyl. But the presence of stimulants, especially in our kind of corner of the state, methamphetamine, some cocaine, has increased dramatically. And I think the other piece that demonstrates how much that's increased, while the percentages are low, there's more instances where people are dying with it's almost always methamphetamine and no fentanyl. Not, again, the majority, but definitely more than last year in percentage. So fentanyl is clearly the deadliest drug in the drug supply, but much to the point that, nobody is saying, mission accomplished for a lot of reasons. Not least of all is the fact that we frankly have a serious stimulant use problem, sometimes causing fatality, but its consequences tend to be, physical health, morbidity, and psychiatric problems.
Yeah. Well, as you mentioned earlier, and rightly so, when it comes to substance use and the work that you're doing and the work that we're doing, it's a landscape that seems to constantly change and evolve, and it's trying to keep up with it, and if possible, when we can, stay ahead of it. But that can be a challenge.
That's true.
So, Steve, I think again, this is the kind of news we want to be hearing about. We certainly want to hear more of it. Hopefully other counties will be reporting similar information as we go forward and get closer to the end of the year. What would you say is the major push or focus or hope as 2024 begins to come to an end and we get into 2025 with where things should be, need to be, where you want to see it go?
Well, of course, we want to see the trends continue, right? So 50-ish% this year. Of course, the year's not over, but we're optimistic that we can say something like this come the end of this calendar year. And we want to be able to say something again the next year, another reduction that's dramatic and significant. But beyond that, I think in some ways, being careful that we don't, not that we would consciously, but that we would lose some of the motivation maybe, or the urgency, let me call it, that has, fatal overdoses have lent to this issue. Because as I said, we still have extremely significant issues. Stimulant use is extremely high, and its consequences are at the human level, of course, are just really, the morbidity is just so high. And it's quite frankly straining systems that aren't prepared really to deal with that. And with stimulant use, of course, we face, unique challenges as how do we treat it, et cetera, in ways that we we don't have the medications yet that, for example, could be a contributor. So that's a big issue. There's going to be subpopulations, stimulant users, of course. We want to really keep our eye on moms and babies. And that kind of actually translates into another major emphasis that we have, and that is prevention. That's our long-term strategy, if you will. Yeah. And so we want to really lean into the next generation and their preparedness to face a world that who knows what it'll look like. I wish, you and I could say, addiction will be largely a thing of the past then. I just think the drugs will be possibly different, but the problems are going to remain.
Yeah, like I was saying, it's a constantly changing landscape, right? But we'll keep doing what we can. And, as you mentioned, prevention is so critical. Raising awareness, making sure people are educated about what's out there and how to respond to it. Steve, thank you so much for sitting down and chatting with us. We're so happy, again, to hear numbers like these, and hopefully we'll hear more and more of the same. I just want to mention quickly, too, if people would like some more information on how to get their hands on some naloxone or test strips, have it sent to them, you can go right to our website. It's oasas.ny.gov, oasas.ny.gov. We send it to you for free, no questions asked, and it'll be just having more of that important medication out there in the population, so we can be continuing to support the type of things that are happening there in Chautauqua County. Steve, thank you again, and we'll have you back, hopefully to talk about even more positive news in the months ahead.
Absolutely. I look forward to being back again sometime.
All right. Sounds great. Thanks so much. And thank you for joining us here for Addiction, the Next Step, brought to you by the New York State Offices of Addiction Services and Supports. I'm your host, Jerry Gretzinger, and until we see you again, be well.